Take a deep breath. Exhale. Easy. Easy. Breathe. Let it go. Try to keep that chin coasting down and back towards your neck. Open. Good. Perfect. You're just going to take your jaw and you're going to try to hit my hand with it. Just push it to the right. Other right. There you go.
So we are just doing some laser here. She's coming in with some TMJ Pain. So we're just gonna be working on her jaw and then a little bit on her neck. How does this heat feel?
Good.
Good, it's not too hot?
No, it feels nice.
Okay. So the laser is really good for helping to decrease inflammation. It's also really good for re-stimulating the cells to kind of help the regeneration process, which just kind of helps speed up the recovery process and bring some pain relief. All right, I'm gonna go back into the neck a little bit.
It feels really good.
Good.
Like a little tingly.
Yeah. Yeah, the laser doesn't feel like much. Like I said, if anything, you feel some warmth from it. We have different heads to use, depending on the area size. So some of them are more for skin contact and it has like a little massage ball. But this one, since it's a smaller area, we're just gonna keep it hovering. Gotta keep it moving. This thing is very powerful. That's why we gotta wear the glasses.
Hey everybody, it is Dr. Warren Kalkstein here at Kalkstein Chiropractic in Towson, Maryland. And I'm with Courtney today. Courtney, you and I, we go back a little bit. You've been coming in, shoulder discomfort in the past, some neck pain. Today we're dealing with some jaw discomfort and headaches. So kind of full circle coming back real quick. I want to talk about Toys for Tots today. We're doing a fundraiser right now. We're collecting toys, so if you're coming in for an adjustment, we've got a little toy bin up front. We are matching people that are bringing in bikes, but if you bring in 3 toys, slightly all new, books, everything like that, right, and the list is on our website, you get a free modality. So we're looking at laser, traction, and dry needling, and I'm going to show you laser for jaw pain today with Courtney. Before we go do that, I'm going to do some soft tissue work on her jaw and her neck. She's been having headaches and right-sided jaw pain. So we'll jump right in. Sound good?
Yes, please.
Happy holidays. Courtney was just asking about the baby. I've got a month-old at home.
Aww.
And so she does really well. I've got one complaint about her though.
What?
She's a grunter.
Aww.
She grunts.
Aww.
So I was 2 nights ago, I was sleeping and I heard this Warren. I'm like in my dream, someone saying Warren, 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 and I'm like, what is going on? So I wake up and it's her just going.
In her sleep?
Because their digestive systems, they're just trying to figure. She's a little grunter.
That's so cute.
A little rhino. For TMJ issues and for upper cervical spine issues, a lot of times they come hand in hand. Some people get headaches from neck pain and tension. Some people get headaches from jaw pain and tension. They're very closely correlated for cervicogenic headaches is what it's called, right? So a tight neck can cause the head to hurt in really the simplest form. So with that, I'm going to be working on her jaw, doing some soft tissue work. This is a pin and stretch technique. The formal term for it is active release technique. And I'm working on the muscles that help deviate the jaw and open the jaw up and down. They're called the pterygoid muscles. They're kind of deep inside. That's why I have gloves on. And we'll be working on that first. And then I'm going to work on the muscles that help clench your jaw afterwards. That's your masseter and your temporalis. Those muscles are on the outside, and these techniques are really helpful for dealing with some of the tension and the pain. The laser afterwards is going to be helpful too. So less talking, more working. I got you. All right, relax that for me. So nice and easy, open up. Good, and when you go to open, I want you to try to think about your chin opening down and back. So don't try to kick it out so much, try to keep that chin down and back. So if you're to kind of envision it, it's like almost like an arc this way. Yeah, good. Close for me. Good. Ease, you're gonna feel pressure. Good, open. And close. Pressure, open. Good. Just like that, back and forth. Open. And close. Popping in the jaw open is really common with jaw pain, and sometimes over time we get more and more of that popping because of the way that the disc is kind of being forced into a position, or kind of it changes in its shape a little bit over time, so you get a little bit of a pressure. Courtney has that going on this right side a little bit. Go ahead and open. And so jaw pain is tricky. People go through a lot of different resources and treatments to dealing with it because it's not an easy thing to deal with, okay? Just putting it frankly. And it takes a lot of time and consistency to change in a positive manner. So we combine a lot of different therapies to help out with it. Dry needling being one of them on some of those tight muscles to help with the pain and help with the tension. The soft tissue work that I'm doing is kind of in that same light, and it helps with the function of the joint itself. So we kind of build up these pore patterns. Stress can do it. Going through a PhD program for X amount of years can do it. And that's what she just went through over the last, I don't even know, how long did it take you? 5, 6?
Mm-hmm.
Open up wide. Open, open, open now. Good. I know that stinks. Okay, let yourself settle a little bit more.
It feels much better now.
Starts to, yeah. I'm just kind of opening the door a little bit, getting things moving in the right direction, and then go ahead and open gently. Good. And relax. Open. There we go. And close. Open. Good. Close. Open. Good. Open. Good. Open. So we're really well suited to deal with TMJ issues, in my opinion, because of dry needling, because of the manual work we do with our hands, where it's a very heavily a joint-related issue for TMJ, and we've got a lot of modalities that support the joint work that we do in here. On top of that, it's a lot of education around physical therapy and management of like tension. And we go down one more level, and it's more so about the breathing mechanics too. Okay, so breathing mechanics play a big role in it, hence the stress portion of it, how we tend to kind of really overbear our shoulders and our neck with certain patterns. Just sitting does that too, it kind of forces us into position. So in that realm, where I think we do a nice job with treating joint issues in the jaw. So go ahead and open up for me. I'm going to do some, basically some PIR, it's called. It's a little bit of activation of the muscle and a stretch of the muscle. So do me a favor, close down on my thumb. Good, just like that. And then just get that activation. I'm going to resist you a little bit. Don't let me win. Don't let me win. You let me win. Let me
Wait, open or close it?
Close it.
Oh.
There you go. Keep it closed, keep it closed. Now relax it. And we're going to open up wide. We're going to feel a little stretch, okay? Good. And then really relax right there. Perfect. You feel that little last bit of stretch.
Mm-hmm.
Now we're going to go as far as you can comfortably go. Now come back off and close it. And open. Easy. Close. And relax. Let it open all the way. Good. Students watch our videos, so if you are a student and if you're kind of in the manual field, jaws, it's a lot of patience. So it's a lot of being patient because it's such a protected area for somebody. Relax. I think there's a lot of neurology behind how much we protect our jaws. And relax. You lose this thing in the wild and you're donezo. So like literally getting someone to truly relax here takes some time. There we go. Good. Now you can kind of feel how it's at another level of stretch. Now close. So I know it's a little bit of a side tangent, but just be patient. We're working on this stuff. And relax, both with outcomes as well as with in the treatment itself. Easy. But it's a very, very rewarding area to work on, because when someone feels better in their jaw, it affects, in my opinion, the most important thing in life, food. Open. There we go. Nice. Good. Close. But they're so aware of it. They're so aware of any change in a positive way or negative. And relax. Let it open gently. Right there, I want you to let go. Awesome. Good. It's super helpful for their neck to be in a relaxed position when we're doing this. They can't relax their jaw if their neck is tight. Okay, good. Take a moment just to kind of get back to reality with their jaw. First ever video for Toys for Tots like this in the history of Toys for Tots. But somehow we got there, right? Mm-hmm. All right, now we're going to show you a different way that we move. This is a present I got today. Check this out. I earned this today.
Who made it?
A little 6-year-old patient of mine this morning. It's like, yes, I made it. My career is, I'm at the peak right now.
Sorry I didn't make you a bracelet.
Oh, that's okay. Don't worry about it. Go relax. I'm covered for today. Next time though, you can bring on a bracelet. Open up this jaw a little bit, and then we're gonna kind of just a little for me, not so wide. Good, and then let it coast over here. Okay. Yeah, exactly. Kind of shimmy it off to the left side. I'm gonna block the rest of your body there, and then you're just gonna take your jaw and you're gonna try to hit my hand with it. Just push it to the right. Other right. There you go. Good. Sorry, my hands are a little balmy. Good, and relax. Keep going across. And then let me stretch it across here. Let the chin go over to the side. Yeah, perfect. Push again. Just get that activation. Keep the chin down and across now. Boom, perfect. Hold that. You can do this on your own with your hands, okay? This is a nice way to activate the muscle, and if you can control it, you can relax it. And relax. Good. Let it come across. Let it come across. Yeah, you feel a good stretch there. Okay, good. I'm going to show you how I work on the neck, okay? We're going to do a little bit more of that pin and stretch on the jaw. Before we get to it, open up nice and wide for me. Good, keep the chin down. Looks, yeah, good. Not so much the neck. Keep the neck right there. But just try to keep that chin coasting down and back towards your neck. Open. Good, perfect. Good, and close. Open. Close. Easy. Relax now for me. That's the masseter. Now we're working towards the temporalis. Open. Close. Open. Close. Go. Go ahead and settle. So I'm feeling how the neck and the joints of the neck move, and I'm palpating. I'm gonna adjust your upper back here first, okay, Courtney? Turn your head to your left. Rest your hand on your shoulder. Hold on to my shoulder. I'm gonna roll you this way gently. Take a deep breath. Exhale. Easy. Nice.
That's good crackies.
That definitely. Turn your head this way. Good. And rest. Reach across and hold. Easy. Breathe. Let it go. And drop that shoulder. There you go. Good. Okay. I'm gonna step right there for you, Gab. I got you. Now take your jaw and let it hang. I'm gonna stretch it. You're gonna feel a release like this, okay? So I really am just taking her neck here to here, but I'm doing it with speed and compression. Good, let it go. There it is. I gotcha. Oh. You're good. Okay, a little release, a little lower, let it go.
Good night.
Good night. So that was the first portion of the treatment. You've been coming here a while. You've had dry needling. You've done our exercise program and fitness program in the past, and that was probably about like 2 years ago.
That helped a lot.
And now you're coming in a little bit more frequently recently, just because the jaw and the neck and the upper back pain has been kind of spiking up on you. So I'm looking forward to helping you. Right now it's once a week that I'm going to see you. I'm going to reevaluate you in a month. Toys for Tots. You got toys, you want to bring them in, you want to get some treatment, check it out. I'll show you the laser treatment for her jaw. You'll get a quick shot of that as well. Hey, it's good seeing you.
You too.
Merry Christmas.
Merry Christmas, double dad.
Double dad. Got 2 of those now. Thanks for watching, everybody. If you got questions about laser, TMJ, neck pain, Toys for Tots, hit it below. Like, subscribe, all that good stuff. Thanks for watching.